All right. Good morning, everyone. I'm here with Danielle, our patient care coordinator. She kind of does like the front and schedules patients. It's like a concierge type of vibe for our non-surgical side. Tell me a little bit about what more you do. I feel like you know your job better than I do.
Yeah, I get new patients scheduled into the office, tell them about our specials, our VIP program.
Do we have any promotions right now that you want to drop?
Right now, we have buy one Morpheus, get one 50% off.
Yeah, it's killer, right?
Which is a really great deal.
Super good deal.
Yeah.
And you just had your Morpheus done 3-4 days ago, I think, right? On Friday.
I got it done, on Friday, exactly.
Yeah, and this was your second treatment. It's a microneedling with radiofrequency treatment to stimulate your tissue at different depths so that you get tighter, smoother, thicker, healthier tissue. And this is your second one. Tell me about
my second one, yes.
Your treatment.
I plan on doing one more next month, and I have just totally been loving it so far. Oh my God. I feel like I actually legitimately see a difference. And I know that's kind of like,
you're glowing.
Whenever I hear people say that, about treatments, I'm like, okay, come on. Like, unless it's surgery, I really don't believe them,
Yeah.
I don't know why. I'm just always skeptical because in my experience, treatments, they don't really have that bang, and I feel like Morpheus really does. And that's what I love about it. And so what I've noticed so far is not only my skin looks and feels tighter, like obviously right now I feel like I'm a little bit swollen, but I love that look because I feel like it just looks so like plump and youthful,
I agree.
I've noticed that my skin feels tighter, looks tighter. My fine lines obviously have been going away, and I feel like I just kind of look overall poreless,
Yeah, we love that. You do look really good right now, and you're only 4 days out of your treatment.
Yes.
So
I did purge.
Yeah, the first day you were red, normal reaction, just a little bit of redness. And the second day, I think you had you have scabbing in certain areas.
Yeah, so I was kind of scabbed over a little bit, but I did purge a little bit, which I looked up, and obviously you told me as well that that's completely normal to do.
Totally normal.
So I started breaking out quite a bit. I also did go to the gym the next day, which I shouldn't have done.
Yeah, no. So sweating can be one other thing
exactly.
that kind of makes your pores, since they're super open right after.
Exactly. I was a bad girl.
Sweat definitely can add in giving you that purge, the extra purge.
Yeah. But I didn't mind it, and it was easily covered up. I do have some bruising, but you asked me when you were doing it. You were like, is it okay if you bruise? Because I think you went a little bit more aggressive, which is what I wanted.
Yeah.
So I think that's why I bruised a little bit under my eyes. But I think that's normal, right?
Totally. I think the under-eye tissue is really thin. You have a lot of vessels there. I was just looking up a photo of how many vessels you have in your face, micro vessels, and it's insane. I will have it populated on the screen for you guys because it's literally 1 million micro vessels, and I'm surprised we don't bruise your entire face when we're doing type of injectables or microneedling. So the under eye is super common to bruise, especially when we're going a little bit deeper. We're doing depth 2 and 1 typically, and you don't usually bruise with depth 1, but some people sometimes do. And
Okay.
it's just to help with fine lines underneath your eyes, to stimulate some collagen. I think under eyes are also really commonly have those really small fine lines that people hate.
Yeah.
And they're I want to get rid of these. How can I? And there's only certain treatments that will actually help get rid of them.
Right. So what do you notice? What is the most common thing you notice about Morpheus afterwards?
Post treatment,
Yeah.
or what to the downtime? Or
Yeah, do you notice that they sit? What's the normal amount of time that they stay red for? Was mine overextended? I feel like last time I healed the next day, remember?
Yeah.
But this is normal, right?
Totally.
Okay.
So I think I went a little bit more aggressive in your settings this second time, which I think is really common wherever you go. The first time a little bit more conservative. You don't know their skin reaction. You don't know how they're going to respond. And the second time you can go a little bit more aggressive, I would say, or just a little bit more step up from your first treatment.
I was concerned that I did something wrong
no,
to make it.
No.
Okay.
Redness is normal for 1 to 3 days, which is kind of what you had. Swelling is normal 1 to 3 weeks, which is kind of, I mean, we're only in day 4, but you have minimal swelling now. But it's totally normal to be swollen and red. Post-treatment, a little bit of bruise underneath your eye. Well, that's pretty much it for like downtime. I think Morpheus is really intense and doesn't have a crazy downtime like a CO2 might have, which has a week of downtime. Even though we love our CO2 and it does great things for patients, I think Morpheus is nice for people that don't have 5-7 days.
Right. Totally. Yeah. I was a little concerned because usually
it's coming around the corner. You can't be down.
Exactly. Usually I'm such a rule follower when it comes to treatments. Like I follow the post care to a T. This last time I got a little bit too relaxed and because it was so easy.
Second time.
Yeah. It was so easy the first time that this time I was like, oh, I can go to the gym, whatever, and, sorry, my throat. And yeah, I was afraid that I caused it to heal slower. That's why I'm like, what's normal? Because I want to make sure that I didn't do anything to worsen it,
I mean, working out does elevate your blood pressure. You get a little bit more swollen from working out. You like to work out all the time, I feel like. So that could also help kind of linger your swelling a little bit longer than the norm. Saunas will make you swell and work. Kind of delay your healing.
You said steamy showers.
Sweating, just kind of getting that blood pressure up. There's so many kind of like little things. As long as you're not going out in the sun right after, using exfoliating products, retinol, hydroquinone, making sure your skin is clean post-treatment Morpheus. Those are kind of like the most important things that you could do. Making sure your products are correct that you put on your face. Right. Like, since you work here, they're all correct. Like we're using Elastin, we're using Gentle Cleanser, we waited 12 hours to put anything on your face. Just kind of those like standard of care items are really important post Morpheus.
Totally, yeah. I'm just so excited to do my third one now.
Yeah, so every 4 weeks we do a next treatment. Then we'll show you the before and afters. I feel like you already have like great skin and like you're already pretty like firm. You don't have many wrinkles, but since you have such a good baseline, it's just really good preventative care for your skin.
That's what I'm looking for sure.
Yeah.
And then what do I do, like maintenance after that or something? I can't. Yeah. Is it like once a year?
So I like to have them come back every 6 months. I like them come back anyways to come in the office and visit me and see if they are doing well, how they're looking. But typically maintenance is like one every year, I would say.
Okay.
You can always do a series depending on what your baseline is. But for you personally, I think your maintenance is a little bit less than someone, for example, 65 years old. Like you need a little bit more maintenance with someone a little bit older.
Right. Yeah. I'm trying to get my mom to come do it.
Yeah.
I think she would really like it. Yeah.
I tried to do it with my mom, and Morpheus is intense. She was trying to take the handpiece out of my hand because she was
no way.
Yes, she was.
God.
But at our office, I know she was like, "Give me this. I'm done."
Oh my God. That's so funny.
But I think at our office we have laughing gas. We have medication if needed. We have Zimmer, which is like a cooling, so it makes it really comfortable for sure.
Yeah, it makes it so like comfortable, so bearable.
I agree.
For the first 2 seconds, I was like, I didn't even know you started.
Yeah, you were like, did you start?
Yeah, because I was a little out of it for a second there,
Yeah, the laughing gas helps a ton, I feel like. Yeah. It really transforms you into a different world for a second.
It really, really helps. Yeah, I mean, I probably would be able to get through it without it, but it definitely makes it like way more comfortable for sure.
Yeah. So if anyone's interested in getting a Morpheus with us, make sure to ask.
Call.
You can ask for Danielle.
For me, yes.
Yeah, and she will get you scheduled for your Morpheus. and you will meet with one of our providers, Carly, Stacy, and myself.
Yes.
Yeah.
And even any other treatments as well, we can also get you scheduled for just a consultation if you're unsure what your steps are, if you're not sure if you're ready for surgery quite yet. Just come in for a consultation and we'll get you scheduled to speak with one of our non-surgical providers.
Yeah.
And they're all amazing.
Nice. And we're located in Marina del Rey, right off of the marina.
Right. And they're super knowledgeable, super sweet. You're in like really awesome hands here. And I'm not just saying that because I work here.
Okay, that's a wrap.
Yay.